I'm Captain Christina Harriet, an ICU nurse in the United States Army.
I'm Jason Driver. I'm an emergency room nurse here at Marina Del Rey Hospital.
Welcome to I've Got Skills. I work here at William Beaumont Army Medical Center, and I'm an ICU nurse. I never thought about anything else to do as a career. I get attached to my patients, so it's a happy day when they're out of the ICU and back home. When I first went into school, got the first year paid for, but then started thinking about how I was going to pay for the rest. I wasn't thinking the military at all. I tried it out for not even a semester, and I said, I like this. It was a practical decision at the time, but I would go back and do the same thing again.
I've been a nurse for 8 years. My original goal was to become a physician. Doctor for me wasn't my role. ER nurse is where I am now. It makes me very happy to be here. For me, the ER is a place where I can be surprised each day. I wake up in the morning, I kind of know my day, but I don't really want to know my day. Biggest challenge in the ER situation is always know what you're doing. Make sure you always get your mind working, strong and focused. Make sure that at the end of the day, your patients are safe as well as your staff.
Hi, I'm Captain Harriet, Christina. Welcome to William Beaumont Army Medical Center.
My name is Jason. Thanks very much for having me.
Yeah, you want to head in?
Yeah, let's do it. You know, I wasn't sure how it was to be on an Army base, but when I got there, everyone was very open and welcoming, and they're all very confident what they're doing.
Let me show you one of our special chronic patients.
Okay.
So this is Mr. Simman.
Simman, all right. We have this training Manikin, which is really cool. And I mean, I wish every facility can have the option of having one, because I mean, the thing talks and moves, and you listen to his lungs, you interact with it. It seems like a great training tool.
It really allows us to get our techniques down before we move to our real live human patient.
I've never seen anything like this before. It's really awesome.
It is. It's a really great tool.
Captain Harriet, she's very cool, calm, and collective. She has a great personality. She's very friendly, so I kind of like that.
I've always enjoyed taking care of people. I look forward to doing my job on a daily basis. So one of the really cool things we have here at William Beaumont is our computer charting.
William Beaumont Hospital definitely has a great program. Their equipment there is top-notch.
So with the computer charting, not just in the hospital, but actually in a deployed setting, I can pull up their clinical notes, flow sheets, labs, radiology results.
Just in the hospitals or anywhere?
Anywhere.
That's impressive.
Continuity of care is really important in the military.
Captain Harriet and I are alike in the sense that we both drive to make sure our patients are safe. And there's a sense of confidence and comfort in what we do for them. Captain Harriet, welcome to Los Angeles and Marina Del Rey Hospital. Come in, let me show you around.
All right, I'm excited.
So, welcome to my little neck of the woods, the emergency room here at Marina Del Rey Hospital.
How many beds do you guys have here?
We have 14 beds in the ER. I showed her today a few different things about the ER as well as the hospital. First thing I showed her is that when we first came here today, the hallways are kind of empty, not much going on, and now a few hours later, the place is kind of busy.
The ER is constant motion, constant flux of people. I don't think I saw the nurses stop hardly to eat.
No, I don't. This is room 1, known as our drama room or trauma room, depends on what's going on. Captain Harriet definitely did walk away seeing the ER a little differently than she did before. Things are out of place, this is over here and that's over there. We like the movement where she really appreciates the controlled environment.
Why did you choose the ER?
I myself more of a anatomy type guy. I like seeing the specimen in front of me, be able to look at him real quick, and then get him out of here.
I like to focus on more the pathos, the physiology of what's going on with that disease or that patient. We're both take charge people. We make sure our patients get taken care of. One of the things the military provides is the leadership opportunities.
Captain Harriet, she has a leadership skill built within her. She looks very confident.
We're expected to take charge. We're expected to be in charge of committees. That's not a requirement in a civilian hospital. As a soldier, you leave the hospital, you may be done on the ICU, but you're still a soldier every day, all day. Jason in the Army. Well, I think he could make it work.
Captain Harriet definitely has a very strong future ahead of her. I think she can leave there today and work at any ICU in the United States of America, in the world probably.
To learn more about my job as an ICU nurse, go to the career page at goarmy.com.